Hello, my name is Miranda Littlejohn. Today I will be discussing a nursing issue that is significantly impacting the healthcare field and can have many detrimental effects on not only patient care, but to also nurses themselves. The nursing issue that I chose to discuss today is the nursing shortages and its impacts on healthcare. Nursing shortages are a global issue. It affects many countries around the world and unfortunately is a growing concern, and it can have significant impacts on the quality of care that patients receive. There are many causes of nursing shortages. I will discuss a few of the most common ones, which are an aging workforce, low wages, limited resources for education, the COVID-19 pandemic, and burnout. As population ages and demand for nursing services increase, there is a continuous growing need for nurses. Aging of the nursing workforce leads to a shortage of qualified nurses, as many nurses are reaching retirement age. As experienced nurses retire, they take with them valuable knowledge and skills that are difficult to replace. Recruiting and retaining younger nurses to replace retiring nurses can be challenging. Younger nurses have different expectations and priorities than older nurses. Nurses are an essential part of the healthcare profession, and they work demanding long hours, including weekends and holidays. Many facilities offer lower wages than what nurses feel are fair and reasonable compensation for their labor. Lower wages can lead to job dissatisfaction, burnout, and an overall decrease in the quality of care nurses provide. The COVID-19 pandemic has increased demand for nurses. It has caused many to leave the profession due to burnout, illness, or fear of contracting the virus. Nursing burnout is a prevalent issue which can have serious effects on nurses and their patients. Burnout can present with emotional stress and exhaustion, lack of empathy, a reduced sense of personal accomplishment, and decreased job satisfaction. When nurses become burnout, they are more likely to leave their jobs or the nursing profession altogether. Some causes of burnout include increased workload, increased nurse-to-patient ratios, increased work hours, and lack of vacation and family time. Health policy plays a critical role in addressing nursing shortages. One way is by providing funding for education and training programs. The Affordable Care Act of 2010 provided funding for nursing workforce development programs. It included scholarships, repayment programs, and grants to support nursing education. Health policy also addresses issues related to nursing practice. One major issue that can have a significant impact on burnout and the nursing shortage is nurse-to-patient ratios. Health policy can regulate the nurse-to-patient ratio by setting minimum staffing levels. There are many legal implications that can put healthcare organizations at risk for a lawsuit. For example, medical errors. When units are understaffed, nurses are overworked. This leads to fatigue and burnout, which can increase the risk for medical errors such as medication errors or documentation errors. When nurses are understaffed, there is also an increased risk for falls, injuries, and infections. For example, a nursing unit is understaffed and the nurse is unable to make sure a patient is turned every 2 hours. This puts the patient at risk for developing bed sores and infection. Nursing shortages can also lead to violations of labor laws and workplace safety regulations, resulting in fines and legal penalties for the institution. The nursing shortage also has ethical implications which can affect patient care. When nurses are working on a short-staffed unit, they may not be able to provide the necessary care for all of their patients, or they may have to choose which patient to prioritize care over. This can lead to less quality patient care and poor health outcomes for the patient. Innovation plays a vital role in the nursing shortage crisis. It can have both positive and negative effects. Positive effects include allowing for the development of new technologies, processes, and procedures that can enhance quality patient care, increase efficiency, and reduce healthcare costs. It can be used to allow for less nurses, for example, by the use of telehealth technologies. However, the challenges that it can pose are the need for additional education and training, time investments, and a demand for more nurses due to the expansion of nursing services. The impact that this has on my practice area. As a float pool nurse working on med-surg units, nursing staff shortages can and do have impacts on both my work life and my emotional and mental health. For starters, I must discuss the impact of the COVID-19 pandemic on being a new grad nurse. When I began training for my position as a new nurse, COVID-19 was still in full force in the units. For the first 6 months, I mostly took care of COVID patients who were on oxygen or BiPAP, struggling to take their next breath. Many of my patients as a new nurse passed away. Many nurses were leaving the bedside or leaving the hospital to go for travel nursing to make incentive money from the pandemic. This left us very understaffed, but yet with more patients as COVID cases continued to rise. It was a struggle to have 5 to 6 patients at a time who were very sick and very high acuity. For many months, we were working 4 days a week, getting called in every call day consistently. As a new grad nurse trying to learn the ropes and develop skills, it was tough. I felt defeated at times and often wondered if I had made the correct choice in career. The nursing shortages have improved significantly since the pandemic, thank goodness. However, there are still days that we still feel the effects of the shortages. I can personally vouch for the truth that nursing shortages can have detrimental effects on workflow, patient care, and physical and mental health for nurses. Excuse me. Many strategies can be applied to improve nursing shortages. One is to offer incentives and increase pay. The hospital can offer bonuses and shift differentials in order to attract nurses and gain help for understaffed shifts. For the younger generation, time off for family time and travel is very important. Offering more PTO could attract more nurses and retain them, even greater than more pay could. Another strategy is to enhance recruitment and retention by offering scholarships for continuing education, tuition reimbursement programs, and sign-on bonuses. Another strategy that is detrimental to nurses is to create a positive work environment. Having supportive management, encouraging teamwork, and professional development is so important. A positive work environment is known for reducing stress, burnout, and turnover rates. Managers who allow for more flexible schedules can also help attract and retain nurses. Self-scheduling is a great nursing incentive, and it allows the nurse to feel more in control of their work schedule in order to balance work and personal life. One strategy that the institution I work for is trialing team nursing. Certain units have hired LPNs to work along with the nurses in order to promote teamwork and to split the workload between the nurses. This has proven to be very successful by creating a more positive work environment and reducing nurse-to-patient ratios. In conclusion, the nursing shortage issue poses a threat to the healthcare industry, affecting not only the nursing staff, but the patients and their health outcomes as well. As discussed, nursing shortages are detrimental and should be addressed. Many strategies are available and should be implemented in order to reduce the shortages and build a facility which promotes a positive work environment and patient care and safety is prioritized.